is for the introduction. So this case is about a patient named Muhammad Ahir bin Sulaiman, a 66 years old man, admitted to the Neuro HDU on 1st November 2019, referred from Lulu Hospital. So the patient diagnosis is lung malignancy with brain metastasis. So for patient history, he generalized body weakness and giddiness for past 1 month, vomiting and felt difficulty ambulating while walking. He has no past medical and surgical treatment and also history of hospitalization. On April 2019, he was planned for sputum culture and sensitivity, and the result revealed that he was negative tuberculosis. So for patient current treatment, he just undergone right craniotomy and tumor excision and right EBD excision. For hourly vital sign and hypocon monitoring, lastly plan for CT scan of brain.
Case presentation. Chief complaint. A 66-year-old man was admitted to the hospital because of he was complained of generalized body weakness for past 1 month, and he also difficulty ambulating, complained of vomiting for past 4 days, and he was feel giddiness for past 1 month. For the presenting symptom, the patient feel pain on back his head due to the right craniotomy and tumor incision and right EBD incision. Okay, the pain was sudden come from on the back of his head, and he complained the pain like throwing pain. Okay, and the pain score was 2 until 4. For the past medical and surgical history, this patient no history of hospitalization or surgery, and he also no allergies to any medication and food. For the social history, this patient married with 9 children. He also working as an oil palm worker for past 30 years ago. And he also active smoker for 30 years and stopped smoking since diagnosed. For family history, biological family was no history of cancer, asthma and heart problem. For the health assessment that we have done with this patient, usually we do the general inspection first, and this patient was conscious, alert and able to speak, and his level of the conscious is 14 above 15, and eye opening is 4, verbal response is 4, motor response is 6. His eye were no infection, no sign of anemia, and his pupil size was equal, and his capillary fill was less than 2 seconds. Okay, we go to the respiratory part. And this patient no short of breath, no coughing, and his chest was equal, fully expanded, and lung sound was resonant. Okay, now we go to the integumentary part. The skin was normal, the skin temperature also normal, and no redness, inflammation, lesion and other. Okay, for the abdominal parts, his bowel sound was present, and abdominal shape was slightly scaphoid, no jaundice, no skin lesion, and no discharge from the umbilicus. For the heart system, on auscultation during the assessment, the heart sound was normal, regular, which is S2 sound are louder at the base of the heart and S1 louder at the apex of the heart. Okay, now we want to focus to this patient complaint, and then this patient complaint of the pain on his back of his head due to the post fossa craniotomy and tumor incision and EBD insertion, and then the pain was between 2 until 4 in the pain score scale, and then the pain on his back of his head was like a throbbing, which is like a beating. And then the pain was radiated to his back of his body, and to relieve his pain, the doctor was prescribed 1 gram paracetamol, and after he take the paracetamol, and then the pain score was decreased to 1 on pain score scale.
What is lung malignancy? Lung malignancy, also known as lung carcinoma, it is a type of tumor due to uncontrolled cell growth in tissues of the lung. Brain metastasis, it is a cancer that has spread to the brain from another location in body. It's considered as a secondary brain tumor and it spread through the bloodstream or lymph system in our body. Risk factors that lead to lung malignancy: heavy smoker, secondhand smoker, exposure to radon gas, exposure to radiation, family history with lung cancer.
According to cancer organizations, 80% of lung carcinomas occur in active smokers or those who stopped recently.
Inhalation of dangerous chemical through the cigarettes can cause carcinogenic to person.
Chemical composition in cigarettes increase the high tendency for lung cancer, such as nicotine, tar, carbon monoxide, arsenic, ammonia, acetone, toluene, methanol and hydrogen cyanide.
Development of lung cancer. Chemical of smoke can cause the lesion to normal epithelium of bronchial, from the normal epithelium of bronchial to become squamous cell lung carcinoma. Precursor lesion progresses. The atypia becomes frankly malignant, and the neoplasm grows in size.
Epithelial dysplasia, known as the earliest form of precancerous lesions, which then transform to carcinoma in situ.
For management of the patient with lung malignancy with brain metastasis, we decide on monitoring the neurological assessment, pain level, for risk assessment, and the vital signs of the patient. First, we must monitor the neurological assessment of the patient using Glasgow Coma Scale. It is to determine the level of the patient consciousness. The scales including eye opening, verbal and motor responding. The current Glasgow Coma Scale of the patient is 14 or 15. The possible way to maintain the Glasgow Coma Scale of the patient is to monitor the patient's neurological assessment for every 4 hourly so that the GCS is not dropped dramatically. Second, we must monitor the pain level using pain score for every 2 hourly. It is to determine the severity, type, and duration of the pain for further treatment to be given. The current pain score of the patient is between 2 to 4 out of 10. The possible way to relieve the pain is teaching the patient on how to do the deep breathing or encourage the patient to rest in bed. And also we can give the prescribed medication by the doctor, for example paracetamol, and also we must give reassurance to the patient regarding the treatment. Third, we must monitor the fall risk assessment using Morse fall scale assessment for every 6 hourly. It is to determine the risk factor for falling and injury. This helps to develop and document of a fall prevention care plan. The current fall risk score of the patient is 40, which is moderate risk for the patient. The possible way to prevent fall risk is by encourage the patient to rest in bed, but the patient sometimes wanted to get up from the bed. After being explained, the patient is forced restrained on the bed. Fourth, we must monitor the vital signs of the patient including blood pressure, pulse, respiration, and body temperature. It is to monitor any abnormality of the vital signs, especially the body temperature, due to sudden fever or headache, since the patient just finished his post-surgery. So, to maintain the vital signs, we must monitor the vital signs every hourly. The medication prescribed to the patients are chlorothalidine sodium in 1 gram. It is given through intravenous. It is antibiotic medication. Second one is dexamethasone in 4 milligram. It is given through oral and it is anti-inflammatory medications. Next, pantoprazole sodium is given in 40 mg. It is given through oral. It is a proton pump inhibitor which helps to suppress gastric acid secretions. Then phenytoin sodium also given in 300 mg. It is given through oral and it is anticonvulsant medication. Lastly, paracetamol in 1 gram is given. It is given through oral and it helps to reduce pain and relieve fever.
Nursing care plan. One of the assessment of the patient is the pain score is 2 until 4. Next, the patient complained of having throbbing pain at the back of his head. Based on the assessment, the diagnosis is acute pain related to right craniotomy and tumor excisions as evidenced by the patient complains of having throbbing pain at the back of his head with pain score 2 until 4. There are some interventions for this diagnosis. First, monitor vital signs like blood pressure, respiratory rate, pulse rate, and SpO2 of the patient to determine the condition of the patient's body system. Second, advise the patient to minimize the movement by resting on the bed as multiple movements can cause the pain. Third, minimize the stresses and sources of discomfort around the patient as it can exacerbate the patient's pain. And then, acknowledge reports of pain immediately to plan for further management of the pain. Then, administer the analgesic medicine as ordered by the doctor to reduce the pain. The other assessment of the patient is the patient needs assistance to do daily activities. The diagnosis for that assessment is self-care deficit related to pain on the back of the patient's head as evidenced by patient is dependent on the other to do daily activities. And there are some interventions for the diagnosis. The first intervention is assess the muscle strength of the patient to plan proper management for the patients. Next, make sure the belonging of the patient is within his reach to ease his movement. The third one is assist the patients when doing the daily activities to secure his safety. The other intervention is encourage the patient to move and do daily activities as much as he can to promote independence of the patient. Next, apply regular routines to the patient so that the patient knows and able to organize and carry out self-care skills by himself.
After a few discussions and research from our group, we got a new information about lung malignancy. We conclude that the main reason of the patient is having lung malignancy with brain metastasis is because he was an active smoker. Therefore, smoking is not good for health, as it contains many chemical compositions that will affect the lungs.